strong containment epidemic than anybody I have heard of. My job today is to bring the wisdom of two experts to all of us, but in particular to use what you know to inform what we do at the fund, and it is to steer the world economy through a very, very difficult time. So with this, my very first question is to Professor Ferguson, and it is to ask him how he sees developments from now on. What is it to be expected? I'm sure this is on everybody's mind. So what are your models telling us about the months ahead?
So first of all, we don't have a crystal ball. Models don't substitute for data. What we can see, though, is a picture whereby most high-income countries have now been severely affected by the virus and have adopted broadly similar, but different in details, but broadly similar measures, and have basically all adopted measures to suppress transmission. They brought them in at different stages. So some countries have been worse affected than others. But in many countries, we're seeing those countries adopting those measures. We're seeing cases and deaths plateauing, at least in some countries, coming down. I mean, clearly in places like Korea and China, cases have come right down already. I think in much of the rest of the world, in low and middle income countries, the picture is much more mixed. We clearly know of some countries like Iran, which have suffered major epidemics, have introduced lockdown measures and seem perhaps to be getting on top of the situation. But for many other lower income countries, they're at a much earlier stage of the epidemic. They have decisions to make in the next few days and weeks as to what measures they will adopt. Decisions which have been made in high-income countries may not be suited to all countries, and so there are some complex balances to be struck between feasibility, the health impact of the epidemic, and the economic impact of controls, which will determine what we really see in the next few months.
I am very curious to understand better why it is so difficult to contain this pandemic. And maybe you can shed some more light on that we are hit so hard.
Yes, this pandemic really poses a perfect storm. I have to say, in the past, we would never have thought about, for instance, trying to contain an influenza pandemic spread around the world. Here we're faced with a virus which is more lethal than typical seasonal influenza viruses, but is not as lethal as, for instance, things like SARS or MERS or Ebola. And that makes it particularly difficult to control. Most people who get this infection have a mild disease, quite a lot have no symptoms at all, and therefore the traditional measures to contain epidemics of contact tracing, isolating people are much more difficult to implement. But on the other hand, we know that a significant fraction, probably about 1% of people infected die. So we have a virus which can spread very readily through the population, will infect a high proportion of the population if we do nothing about it, and causes significant deaths. I actually think it's a testament to the world today and our ambition that we are attempting to control the spread of a virus like this. This really hasn't been done in the past. The closest example was in 1918. For instance, some United States cities attempted to control the spread of Spanish influenza, but ended up lifting measures, partly because of their impact, and seeing resurgent second waves. We've now done this same thing at almost a global scale, and countries are now faced with the decision, countries who have introduced lockdowns, how do they return to something more resembling normality, allow economic activity to resume, and yet keep transmission suppressed and avoid the very large numbers of deaths which would otherwise result.
When we think of countries and how they respond, indeed there are huge differences in how they're impacted and what they can do. And actually I would turn to Professor Ghani. In advanced economies, containment measures are in place, they work. But in some developing countries where people are living in dense urban settings, in urban slums, containment is really not possible. So what can countries that are faced with weaker health systems and very dense urban areas, what could they do?
So in low-income settings, obviously, they're a very different context. And one of the most difficult aspects is that access to health and health systems is much weaker. And one of the things that has been focused on very much in high-income settings is building surge capacity and, for example, getting things like mechanical ventilation and ventilators in place. We have to remember that in many settings, intensive care units just really aren't there, and these types of interventions aren't going to be available. And other tools and simpler techniques, for example, like supplying oxygen for those patients that need it, may be an appropriate alternative response. In terms of the types of social distancing and interventions, some very simple techniques might be helpful. For example, providing running water to places that don't have that, so that personal hygiene can be better and hand washing can be improved, would be one example. Other social distancing techniques might just require a small change to behaviour rather than the wide-scale lockdowns that we're seeing in other countries.
Let me give you a bit of a sense as to how this is different for people who are dealing with the economic impact of this crisis. It is actually very, very unusual because it requires economies to stand still. And when they stand still, the normal ways in which we fight an economic crisis by providing stimulus for demand to go up and production to go up simply doesn't work. We actually do not want people to go out and shop, and we do not want people to go and produce. So what we are following in this crisis is three-pronged advice. One, accept that there has to be a bridge built over this standstill period by helping vulnerable households and vulnerable firms to be able to sustain, stay afloat during this period of time. In other words, provide massive support for the economy, for the society in this standing still period. Two, provide massive liquidity so the economic system, the financial system, can continue to function. And this is what central banks have been doing. And three, think early about the way you're going to go towards recovery. What are the right policies so we can move forward? The world has done an incredible job by pouring $8 trillion into fiscal support to households, to workers, to firms. And yet we are not even at the point when we would be mobilizing stimulus to inject in the economy for recovery. And one question that we are asking ourselves, and I need your help to answer it, is how to think about gradual restart, because clearly it is not going to be like switching electricity on and off. What is your advice as epidemiologists, how to go about restart of the economy after this period of forced standstill?
So this is the key challenge, that what we have done, at least in high-income countries, is stop the epidemic in its tracks. But that doesn't make the virus go away. So the challenge we face is, if we lift these measures too quickly, we will just get a resurgence of the epidemic, and it could be even worse than the first time. And so we have to find a set of measures which are less disruptive economically, but still maintain control. And there are some tentative examples of countries which seem to be succeeding in that. And obviously there is China. China's restarting its economy now, albeit I realize at a much lower level than a year ago. The other one I would point to is South Korea, which has adopted some social distancing, clearly, but nowhere near the same sort of lockdown measures as many European countries, the United States, have adopted. And almost certainly, for those high-income countries, the strategy is going to involve extensive testing, the transmission in the community, contact tracing, isolation. I think the key issue is, what are the range of countries for which that is a suitable solution? Because that will carry its own costs and ongoing economic costs as well. And it's only feasible for certain countries. As my colleague Azra Ghani was saying, I think other countries may make effectively other decisions to try and mitigate the epidemic, reduce deaths, but not necessarily stop it completely, and therefore in some sense get the epidemic over with in the next few months.
Yeah, I would just add to that I think this nicely illustrates why this is a global problem, and we will only be able to solve it through a global solution, because countries, of course, are connected as well. So even if one country implements one set of interventions and processes for trying to recover, we need to stimulate the global economy, not just the local economies. And I think particularly in those lower income settings, those countries are particularly impacted by what is going on around them. And I think therefore the onus is on the higher income settings really to provide that support, to provide the knowledge that they've gained through experiencing these epidemics, and to provide the tools, both financial and also in terms of human capital and capacity to be able to know how best to cope.
Mm-hmm. At the IMF, we have adopted a philosophy that saving lives and saving livelihoods go hand in hand. First, we need to make sure that we are successful in stopping the pandemic everywhere, so that can translate into resumption of economic activities. And two, when we provide financial support, we would like to see it going for paying doctors and nurses and making sure health facilities function, but also protect the most vulnerable people and the most vulnerable parts of the economy. That this has to be one strategy rather than two that are put against each other. And I would be interested whether you think this is the right approach to take. There are many who are saying it is either you save lives or you save livelihoods. We, on our side, we think this is a false dilemma. We have to do both. What is your reaction?
I absolutely agree. And actually, we've all been asked to somehow look at those as if they were trade-offs, and they're not trade-offs, they are partnerships. We can't have a health system without a workforce, and we can't have that workforce without ensuring those livelihoods are sustained. So I think they go together. There can often be a sort of focus on one output, and particularly lives saved through averting the effects of the pandemic versus the lives saved from the economics. And we have to move away from that and consider these things.
I know that Professor Ferguson said that even in the Imperial College, you do not have a crystal ball. I was hoping you might have one. But I'm going to still press on you. We at the IMF are projecting that there could be, after a deep recession, the beginning of recovery towards the second half of the year, especially the last months of the year, and then 2021, a partial recovery of the world economy. As epidemiologists, would you be confident that this may indeed be the course, or would you tell us, well, be careful, there are still unknowns and risks ahead?
I think it will vary by geography. The countries which decide to try and mostly mitigate, but not necessarily stop the pandemic, will see a much higher impact in the short term, but will, in some sense, put the pandemic behind them. I think most high-income countries and China are on a course whereby they will have to have very substantial controls in place until really we have vaccine, which is not likely until the middle of next year. The extent to which, though, those, let's say in 6 months' time, those control measures are impacting economic activity is much harder to predict, though. I mean, I wouldn't underestimate human ingenuity. You can see it in operation in China now, in terms of being able to resume activity, people earning their livelihoods, but still maintaining control. But it will, I think there will be economic impacts well into next year. And also, I mean, I'd ask you, I mean, I've read about these things, but as well as the local economic impacts, perhaps you could tell us something about how you see the kind of global economic impacts and the impacts on supply chains and connectivity.
Well, what we see as immediate global impact is a very significant drop in economic activities, taking the world into recession. Just 3 months ago, we were projecting that 160 countries will register positive growth this year. Now we are projecting 170 countries to have negative growth this year. What we also see is that in economic terms, emerging markets, developing economies are at highest risk. Why? Because they do not have the capacity advanced economies possess to bring monetary policy easing and fiscal support on a very large scale, and yet they are on the receiving end of additional difficulties. And that takes us to a very important conclusion for us in our work. Step up financing for developing countries. We actually are doubling emergency financing right now, going from $50 billion to $100 billion. And we aim to have this delivered within weeks, not within months, very fast. We are also actively working on debt relief. We are advocating for a simple concept. When the economy is standing still, poor countries should not be expected to service their debt to official bilateral creditors. And we at the IMF actually yesterday approved a 25 countries debt relief that for the poorest of our members in terms of their obligations to us. So we have to be mindful of the difficulties that emerging markets, developing countries would be experiencing, and we have to do for them what advanced economies do for themselves. Very massive support, building this bridge between now and the period when the pandemic retrieves. In fact, I wanted to turn to you both and ask you, from your perspective, from what you know, what would be your advice to the international community? What do you think we must do?
I mean, I think the most important thing at this point is to move from being reactive to being strategic. Countries need to think about what they want to achieve and then the feasibility of achieving it. And if they feel it's not feasible or the costs are too high, to adjust those objectives. I fear that at the moment we're being driven initially for lockdowns, understandably, by overwhelming healthcare demands and mortality and driven into certain measures. We now have the opportunity, not for long, but to stand back and say, what do we want to happen in the next few months and how do we get there?
Professor
Ghani?
Yes, I think as we learn, I think an important thing is to share the knowledge that we have learned from experiencing these epidemics. We know a lot more about the disease, but I think all countries are learning about what works and what doesn't work. And so by sharing data, sharing information, I think the onus really is on us to try and improve what's out there and help and support those countries that just have lesser capacity.
I am actually very pleased that we have this conversation, and I listen to you. It is reaffirming my conviction that in terms of economic policy action in this environment, we still need the macroeconomists, but we also need the epidemiologists to make the right decisions. Professor Ferguson, you fought and you are fighting the pandemic for all of us, but you also fought coronavirus for yourself. I'm so glad that you won. Any messages that come from your personal experience to those who watch us?
Well, actually, I mean, both Azra, Ghani and myself got infected with coronavirus. I think, I mean, the messages are, I self-isolated as soon as I had the first signs of a cough, and basically it was isolated for nearly 2 weeks. I think it's about, looking after yourself clearly, but also looking after the community. If we want to slow the spread of this virus, it's important for people who, like me, I didn't have severe illness, was mildly ill. It was not pleasant, but I didn't need medical attention. For those people to behave, responsibly and try to reduce the risks to others.
This is a great way to wrap up our discussion. We need to act as a community, protect yourself and protect everybody else. And that applies also for the economy. Helping each other is the very best way to go through what is, at least in my lifetime, the most dramatic challenge we are faced with. I want to thank you from the bottom of my heart for helping my colleagues to formulate projections and policy recommendations. And I count on you to continue with this newly found unity of purpose of epidemiologists and macroeconomists for the well-being of people and the well-being of the world economy. Thank you.
Thank you very much.
Thank you very much.
Thank you.